And welcome back to In Focus here on News Radio KMAN. I'm Brandon Peoples. Dave Lewis is producing things on the other side of the glass. And I'm going to shift gears here, talk a little bit about some different issues here. We're talking with Riley County Health Department Director Jennifer Green, who joins us in studio. Thanks for being here.
Thank you. Good morning.
And I've also got Brandon Irwin, Community Liaison for the Flint Hills Wellness Coalition. Good morning.
Good morning.
Understand here the topic we're discussing is African Americans in Riley County expected to live shorter lives than any other racial or ethnic group here, and that's kind of the topic here this morning. And you hear that, and it's like, you know, how is that possible, and what can we do to change that?
Yeah, it's the question that we need to be asking right now. I mean, in a way, we're here to kind of sound the alarm on something that's just not part of the conversation right now. And I think in 2017, it was the Kansas Department of Health and Environment released some data at the county level on life expectancy by different racial and ethnic groups. And the thing that stands out very clearly is that in Riley County, African Americans are expected to live shorter lives than almost any other racial and ethnic group. And so I want to run through some of a question, of course, that pops up is, well, why? And that's a complicated question, but I want to read through, just to make this land, some of the reasons why, and we can look at other data to help us understand this. And so if African Americans are admitted to the hospital for diabetes at nearly double the rate than any other racial or ethnic group, admitted to the hospital for stroke at nearly double the rate as whites and other races and ethnicities, admitted nearly 20% higher rate for heart disease than whites, admitted for drug-related illnesses at 3 times the rate, admitted to the hospital for behavioral health issues at 25% higher rate, at nearly 8 times the rate for asthma, 7 times the rate for COPD, almost double rate for low birth weights, black women are 3 to 4 times more likely to experience maternal death than white, Asian, and Hispanic women. And so there is just so clearly a problem here that we're not talking about, and we need to start talking about.
Well, it's interesting because look at the demographics here of Manhattan, and it's only 5% of the population, and those are pretty staggering numbers that you just spewed off here. And Jennifer, I'll bring you into this conversation too. It sounds like maybe there's a lot of this might have to do with income disparity. Is that about right?
So that's a great question, and I think that's something that we often in public health turn to. But a lot of the statistics that Brandon rattled off here, if we control or if we take into account income and education, those disparities still exist. So even if you think about a poor or a rich African American woman or man, and we compare that to somebody that has even a lower income or a similar income, we see those health disparities still persisting. And so that's something that we want to make sure we take a look at. So even if we educate, we increase the levels of education, we increase income, we are going to still see those disparities. So we really need to dig deeper and think about what else is going on here besides those things. And there's a lot of, it's not one answer. There's a lot of different things going on. It's a complex problem, but one of those things might be zip code. So we know that zip code is a really good predictor of life expectancy. So, where you live matters. African Americans are much more likely to live in concentrated poverty than other racial and ethnic groups. And so that's one reasoning behind that, living in concentrated poverty. But income is not the only answer here. There's lots of other disparities that or other causes.
In fact, in Riley County, African Americans have, on average or median, I want to say, a higher income than other racial and ethnic groups. And so there's just obviously not the variable that explains what's going on here.
We've got a phone call here, so we have a first question here of the program. Let's go to the phone lines. Good morning. You're on In Focus.
Not so much a question as I'm sure you'll be talking about it, but I go to a high-speed eye doctor in Kansas City at Topeka, and I want to point something out. I tell all my friends of color, you want to keep checking your eyes. At when I go to the office, about 65% of the people there are of color in Kansas City and Topeka. And it's caused because of what you just said earlier. There's a lot of diabetes. There's also glaucoma. And it all works together, and that's what it causes. And it appears to me that people of color must be susceptible to that. So if you're not thinking about doing it, that's something that sure needs to be pointed out. I point it out to every one of my friends of color because it's very, very important. And I've got several of them that have diabetes, and I take care of it, and I'm on them all the time. So that's just a little tip for you. Maybe it helps you. I hope it helps some people. Thank you very much. You're all doing a great job.
Thank you. So, oral health and eye health are really good indicators of your overall health. So if you don't have good oral hygiene or good eye health care, that can definitely be an indicator of life expectancy and other health outcomes that we might look at. And you made a point, I'm not sure if you live in the county or where you're located, but access to health care is one part of that issue. So if we're not able to access health care where we live, and we have to go outside of our community to access healthcare on a regular basis, that's a challenge. So if we're not getting our diabetes checks, if we're not accessing healthcare, if we're not getting our eye health taken care of, what are the reasons behind that? And but I do want to point out it's not only an access to healthcare issue. Even as we mentioned before, even people that are insured, even people that do have seemingly good access to health care through their health insurance, we still see these disparities that persist. So there has to be something else going on, even if we take into account education and income.
Right, and if I'll add on to that a little bit here as well. And so when we think about like how to explain health in general, usually it's almost always our mind goes first to, well, it must have something to do with healthcare. Which of course is important, and it must have something to do with health behaviors, right? Like what we're eating, are we exercising, are we doing, the things that we, have control of. But what we also know, and in public health, we've known this now for around a decade, and it's really been coming to the surface, is that those factors only make up about half of the factors that contribute to health. The other ones are what we call social factors, right? Again, in this case, we already pointed out the fact that, income is not necessarily the thing that explains this, but it is things like the economy, it's things like education, right? It's things like housing, and we need to take those things just as seriously as we do, access to health care and also health behaviors. Now, the other thing I would say about access to health care is not everybody at the point of care has the same kind of experience as everybody else, right? And so a huge factor is what we might call cultural competency, right? Do you have a care provider that speaks your language, whether that's literally speaking your language, whether that's Spanish, or somebody who can explain things to you in a way that you understand? And secondly, does your healthcare provider look like you? Right, that is a sacred relationship built on trust, and that's really hard to cultivate if you don't feel safe and comfortable in that environment.
And kind of going off what Brandon was saying, if you are able to have that experience with somebody that looks like you, so if we think about mental health, and there are many people, African Americans in the community and nationwide, that mental health care is something that is a very personal relationship, even beyond going to your primary care provider. But you divulge things, and it's such an experience in which you are giving, you're going in depth to your history and experiences of trauma. And it is often helpful if that person looks like you. So in our own community, do we have mental health care providers of color? So if you do need mental health care access, does your provider look like you, and can they relate to the experiences that you've had, so you're not re-traumatizing yourself by trying to have to explain to your mental health care provider experiences that you have had already. So that cultural competency is really important. And we often talk about cultural competency training or racial bias training, but we don't want to stop there. That is a good piece, and we should be doing that, but we don't want to stop at that. There are things we need to do beyond that.
All right, those are good points here. And as I understand, no, we don't. Okay. We're going to take a break. I thought we had a caller here. We'll open the phone lines back up here during the break, and we'll continue this discussion when we return on News Radio KMAN.
Your appliance specialist, located in the West Loop Shopping Center.
We're back here on In Focus, News Radio KMAN. I'm Brandon Peoples, Dave Lewis on the other side of the glass producing things for us here today. We're talking with Jennifer Green, Riley County Health Department Director and Community Liaison for the Flint Hills Wellness Coalition. Brandon Irwin here about racial disparities in healthcare and access to healthcare, things like that. Let's talk a little bit more about this. You're mentioning here how a lot of folks won't go to providers if they don't look like them. Are there initiatives that maybe can help encourage more minorities in the health profession?
Well, that's a great question. So I don't know that it's that you won't go to them, because oftentimes you don't have a choice. So if we only went to healthcare providers that look like us, many of us wouldn't seek healthcare. But you bring up a great point about workforce development. So are we, as a community, as a nation, cultivating doctors and healthcare professionals, nurses, CNAs that are of color, particularly African Americans, and there are initiatives statewide at many universities that are trying to get African Americans into medical school. But it's not just about getting them into medical school, but keeping them and helping them graduate from medical school, helping them to write that college application. So if you have somebody in your family that has been to college and can help you through that process, explain the medical school process. When do you need to take your entrance exams? Do you need to do an internship? You can't decide those things your senior year. And do we have resources available to students that will help cultivate that and help you through that pathway of not only applying, but do you have somebody that writes your letter of recommendation? Is that somebody, do you know a physician? Those letters or recommendations need to come from physicians. Do you have somebody in your family or a family friend that is able to even write that letter of recommendation for you? And if you don't have that, because you didn't grow up in a neighborhood where there's lots of doctors and nurses, then that opportunity, you're already a step behind or 3 steps behind your counterparts. So there is a workforce development piece, not just for physicians, but for nurses, especially psychiatrists, especially African American male psychiatrists, that we really need to talk about in getting those students through medical school into their practice. So that's one component.
Yeah, and I want to make sure we don't get too bogged down in just the healthcare system here. So, again, what we're talking about is a community level sort of phenomenon here, right? In what ways is this community designed or not designed to cultivate health for everyone? And so things like do you feel safe in your community? That is a critically important question that doesn't necessarily have everything to do with the point of care, right? And who your doctor is. And so, a couple of years ago, the data came out, for example, on disparities in arrests for black people in our community for marijuana possession, and that was between 5 and 7 times the rate as for white people. Like that is something that we have to take seriously, and something that impacts our health. Like those kinds of numbers and the experience of what it's like to be a black person in Riley County literally gets under your skin. And so while we're here talking, somewhat academically about like what's happening or how we explain that disparity, really the experts on what's going on here are the people in the black community. And until we partner with the black community to really figure out what's going on here, we are just kind of talking somewhat academically here.
Okay. We have a caller here on the line. Good morning. You're on In Focus.
Hi, how are you doing? Have you guys ever decided to add the American Indians to any of your studies?
Yes, so that's a really great point.
Good question.
American.
As far as I know, they're about the only minority group to really left because minorities means less. And there's not too many of the Native Americans around, and I'm speaking as a certified Native American.
Right. So there are many. I'd still say we're definitely moving to a country that we have many more minority populations here, but white Americans are still. We have more white Americans here than others, and we are definitely having more multiracial. And so those Native Americans are definitely included in those studies. I think some of the times the challenge in research is that Native American and American Indians have a smaller number of populations, so it's harder to get good data from that. But we certainly want to remember those as and the same points still stand, right? The disparities are wide for American Indians for many reasons, lack of access, those same systematic biases, and that what Brandon was alluding to. They're systematic. We can talk about individuals, but really it's a systems level problem that we want to address. And some of those same things we want to talk about with Native Americans, we also are talking about with the African American community.
Yeah, and depending on, and I really appreciate the call and the comment, depending on what measure of life expectancy you're looking at, the Native American population, it's actually even worse. Again, that's just not part of our conversation about public health in our community. But as a Native American yourself, and I don't know if the caller is still on the line, I would like to know what his experience is like with things like accessing care, and do you feel safe in our community, and what kinds of barriers do you see or experience to good health?
Well, I'd love to answer that because I was born and raised in Manhattan.
Beautiful.
And I was probably one of the only ones that had the KKK come after him at the Manhattan High School. But as an American Indian, I was very safe in Manhattan. And I've had a job my whole life, and I've learned to take care of myself.
Great.
So I think that, there's a reason why you go to a national park and it says do not feed the animals. It's because they get, if you feed them, they forget how to hunt. And so if we keep giving away stuff in this country to everybody, and that's including the American Indians, that, they're going to forget how to take care of themselves.
So I think these are systematic things that we're talking about here, and not about giving away things to people, but helping people have the same opportunity that others in our community have. So if we're talking about creating systems level change or policy level change, those are things that impact everybody. So if we think about smoking as a great example, if we have a smoking policy that to protect our little ones, secondhand smoke in our parks and in our community buildings, then that is a systems level change that will impact everybody, but in particular racial and ethnic minorities that in their own communities, asthma rates are high. So some of the policy changes that we're talking about will have an impact on the community, but we will be able to close health disparities amongst our most vulnerable, including American Indians and African Americans.
All right. Well, thank you for the call here this morning. Great conversation here, though. And you mentioned earlier a little bit about bias here. How much is that a problem, would you say, in Riley County? Maybe not just in Riley County, but all over.
Well, the only data that I have, it comes in two forms. One is the data that I shared about racial bias in the local police system, and I do want to point out that that there is an initiative underway right now, and the new director is among the champions for that, as is a local group called the Coalition for Equal Justice that has been working to address this. But as far as the pervasiveness of that, it's the data that I shared. The other data that is highly meaningful and relevant and valid here is people's stories. we don't have a lot of that data, if you will, and probably for good reason. I mean, if you don't feel safe in this community, you're probably not going to stick your neck out and and talk about that. But it's a great question, and that really is the only data and example that I have.
As we think about bias, that really gets to the individual level, healthcare provider or the person walking down the street, and that is important and certainly a part of the experience that we have. But I do want, and one way to address that, and what the police department is doing is, racial bias training, and that is an important piece. But we also want to think about what are the broad level systems things that we can do to decrease disparities in our healthcare system and in our community. So Brandon talked about housing, and we can think about if you live in a food desert. So if you live further away from a grocery store and you're not able to walk to your grocery store, that is a result of the way we built our communities. So do we have access to a grocery store near where we live? Do we have a bus stop near where we live? Those are structural things that are not necessarily about individual people.
I'm sorry, I got to wrap up here, but if people want more information, are you guys continuing this conversation somewhere else?
Yeah, so you can reach us on our Facebook page, Flint Hills Wellness Coalition. Send us a direct message, a private message, or comment on the Facebook Live post event that we've had today.
All right. Thank you, guys.